Welcome to the podcast. I'm Jess, a family nurse practitioner and legal nurse consultant, and this is the space where healthcare, law, and real-life situations intersect. Each episode is designed to break down complex medical and legal topics in a way that's clear, accurate, and grounded in evidence, without fear, misinformation, or sensationalism. Whether you're a healthcare professional, attorney, gig worker, parent, or simply someone who wants better understanding of how medical events and legal responsibility overlap, you're in the right place. Let's get started.
Hook. Imagine you arrive at the emergency department with a high fever and a severe infection. The chart flags you as allergic to penicillin, so the team avoids a frontline antibiotic. Later, you learn the allergy entry was wrong. It was a note about nausea from a different medicine, not a true allergy. That single mistake changed treatment and delayed recovery. Today, I'm going to show you how to avoid being the patient caught off guard by errors like that, how to read your record, where mistakes commonly hide, how to ask for fixes, and how to use your own records to keep care safer. Section 1. Why your record matters, what's inside, and how to access it. Your medical record is the shared memory clinicians use to make decisions. It influences diagnoses, medication choices, follow-up plans, and who gets copied on care. If the record lists the wrong problem, wrong allergy, or wrong medication, that error can propagate every time a new clinician opens the chart. So what's inside? Think of the record as several consistent sections: visit notes, history, exam, assessment and plan, problem list, diagnoses the clinician flagged, medication list, allergy list, lab and imaging reports, and administrative items like immunization records and billing notes. Plain language, the note explains what happened at a visit. The problem list is the short directory clinicians scan first. Medications and allergies are safety items. Those get checked before giving anything new. Labs and imaging are reports written by labs or radiologists that describe results and often include a summary line called an impression or conclusion. Now, how do you get access? Most systems have a patient portal, MyChart or similar, where you can view and download records. If not, you can submit a formal records request to the Medical Records or Health Information Management Department. Under the law that governs health privacy in the U.S., HIPAA, patients typically have the right to access their records, and organizations usually have about 30 days to provide them, sometimes with a short extension. Be ready to verify your identity. A driver's license photo, date of birth, or a signed release are common. Tips: create an account on your portal, enable two-factor authentication, and download PDF copies so you have a snapshot you control.
Section 2. How to read clinician notes and spot errors. Clinician notes follow a pattern. Look for the assessment or impression. That's the clinician's working diagnosis, and the plan, which lists tests, treatments, and follow-up. If you see abbreviations you don't know, pause. Don't panic. Common shorthand like SOB means shortness of breath. HTN is high blood pressure. Imaging reports often include a clear impression line at the end. Read that first to get the main point. Now, what to watch for? Red flags include allergies listed that you never had, medications you no longer take still on the active list, duplicated chronic conditions, wrong gender or birth date, and missing important notes like a recent hospitalization. You might also see terms that sound definitive when clinicians are actually considering a possibility. For instance, a note that says rule out pulmonary embolism is not the same as saying you have one. If something looks wrong, don't assume it's unchangeable. It's completely reasonable to feel frustrated when you find mistakes, but there are calm, effective steps to fix them. Section 2 continued. Requesting corrections and realistic expectations. You can request an amendment to your record. Start by contacting the Medical Records Office or using the portal's request function. Keep requests short, factual, and evidence-based. Here's a sample script you can adapt and send as an email or portal message. Hello, I'm requesting an amendment to my medical record. On date, the allergy list includes penicillin, but this is incorrect. My true reaction to penicillin was nausea only and was never evaluated as an allergic reaction. Please update the record to reflect that the entry is incorrect and add this note: no documented allergic reaction, reported nausea only. I am attaching any supporting documentation and would appreciate confirmation of receipt and the expected timeline. Most organizations will either make the amendment or add an addendum explaining why they disagreed. They should respond in writing with their decision. If they deny your request, you can submit a brief statement of disagreement to include in your record. Keep copies of all communications and note dates and names of staff you spoke with. If a correction could affect care, for example, an allergy or active medication list, ask your clinician to document the change in a progress note too, because clinical notes are the documents most providers read first.
Section 3. Using your records to advocate and protect your care. Bring your record to appointments. Print the meds and allergies list, or bring a saved PDF on your phone. Before a visit, highlight discrepancies and prepare 3 focused questions. What has changed since my last visit? Which of these diagnoses should I be most concerned about? Are these medications still recommended? When coordinating between specialists, share a single, up-to-date summary called a problem medication snapshot to reduce conflicting instructions. When sharing records, use secure portal transfers or encrypted PDF. Avoid sending full medical records over unprotected email when possible. If you run into resistance when requesting changes, ask to speak to the facility's privacy officer or patient advocate. For complicated disputes, for example, if an error leads to harm, consider getting help from a patient advocate, ombudsman, or attorney who understands medical records and documentation.
Recap and 3 clear takeaways you can use immediately. 1. Check your active medication and allergy lists every time you get care. If something is wrong, tell the clinician and start a records amendment request. 2. Download and save a PDF copy of your record after major visits or hospital stays, so you have a dated snapshot to share with other clinicians. 3. Use the simple script I shared when you ask for corrections, and if the provider refuses, submit a short statement of disagreement to be included in the record and escalate to the privacy officer if needed. Bonus practical tip: carry a single-page summary with your name, current meds, serious allergies, and emergency contact. It's the fastest way for a clinician to get the essentials in an urgent moment.
If this episode helped you, I've created a downloadable checklist and sample amendment templates you can use the next time you log into a patient portal or call medical records. Head to FAQ by nursejessicaconsulting.com/records to get the resources and printable scripts. And if you want more episodes that make medical topics practical and usable, please subscribe to the podcast so you don't miss future guides.
Thank you for listening. If today's episode helped clarify a medical or legal issue, or made you think differently about how emergencies and accountability intersect, that's exactly why this podcast exists. I'm Jess, a family nurse practitioner and legal nurse consultant, and I work with attorneys, organizations, and professionals who need clear medical insight in complex cases. You can learn more or schedule a consultation at facbynursejessconsulting.com. If you found this episode valuable, please share it, subscribe, and leave a review. It helps this education reach the people who need it most. Until next time, stay informed, stay compassionate, and always put safety first.